Hello and welcome back to the Pause It podcast. I'm Dr. Sam, and with me, as always, is the great Dr. Robert.
Hey guys, welcome back.
All right. Well, today we're going to get right into our topic, which we'll have fun, but it is a pretty sad topic. And so we're going to talk today about euthanasia. It is a sad topic, but it's a really, really important topic, and it's one that we deal with every single day. I'm guessing you deal with it every single day as well.
Yeah, I was actually curious because I don't know, like, how many do you do a day sometimes? Because like, I know how many I do it, but I actually don't know the general practice side because, like, you guys probably get both emergencies that need to come in for it, and then like owners actually plan it. Because that's what the most of my conversations are with people, that they want to wait the next day to do it with their primary practitioner sometimes. So
Right.
I was curious, just in general, how many of you guys will end up doing a day sometimes?
Yeah, it's an ebb and a flow. So, I mean, it's kind of one of those things where there are I would say certain times of year, we're heading into one right now,
Yeah.
where we actually do see quite an uptick of euthanasias. And I think there's that like kind of somewhat mean joke out there of like, well, people want to make room for a new puppy, so they euthanize their pets at Christmas. But I don't think it's that. I think that Thanksgiving and Christmas come at the beginning of the winter.
Hmm.
And I think that when people start to look at maybe making plans for the holidays or even going away for the holidays, and then they look at their dog and they think, I don't know if I can leave you at a kennel. I don't know if I can, put you through another winter, because at least here in the Midwest, like it gets cold. It's harder on their joints. They're afraid of them
Hmm.
falling in the snow. They're afraid of like ice, or you know what I mean? So like really, really legitimate concerns that just happen to come along at this time of year. So
Yeah.
I do think that there are times, I mean, there I mean, I've done as many as like 4 in a day,
Oh, that's quite big. Yeah.
sometimes 5. I mean,
Yeah.
that's probably the most, but I mean, I work with like 2 other doctors, and
Okay.
there are definitely times where like we'll each have several on the
That's
schedule.
tough,
Yeah.
especially
Um
during this time of year. Like, I agree. I think there's definitely an uptick during the holidays, and I've had a bunch of people give different reasons for it. Whether it's, I see a lot more like on the day of Christmas actually, which is always kind of a bummer.
oh, that's really sad.
And a lot of times I think it's just because like they spend a lot of money on Christmas, and then all of a sudden they have a big emergency bill that they didn't plan on having.
Hmm.
Um, or where it's a family's back in town, it's like a kid that's off at college, and they don't know when they're going to see them next.
Yep.
And they're like, well, this is my chance to say goodbye because they haven't
And
been
then
doing
as a
well anyway.
family, yep. Or even on the other side of that will be somebody comes home from college and is like, "Oh my gosh, they
Mhm.
look horrible." And
Yeah.
if you're looking at a dog or a cat or something every day, subtle changes like
Mhm.
happen and you might not notice them, or they're masking it really well or something like that. Or even the stress of the holidays. So having a bunch of people in your house, the dog or
Yeah.
cat is hiding or sad, or you know what I mean? So but yeah, I mean there's really not one specific thing I think that leads
No.
to it. I think that probably the biggest difference between the way you deal with it, the way I deal with it, is really just the planned nature of it, right? I mean, we see a lot more planned euthanasias where people call and say, "Hey, they're not doing well. I think
Mhm.
today's the day," or "I think yes, like tomorrow's going to be the day," or you know what I mean? Every once in a while, you can kind of see where it's going to go. Sometimes we'll have a pet that we've been treating for a disease for a really
Mhm.
long time, and we'll start to see it, head in the wrong direction.
Mhm.
And we do have emergencies. I mean, we definitely have things that come
Oh, for
in
sure.
that people were not expecting. Their pet wasn't feeling well, and they weren't expecting them to have a huge tumor that's bleeding in their abdomen
Yeah.
or something like that. So, I mean, we do get a handful of those as well.
Yeah. Those are definitely the more common ones I'll end up seeing. Or a lot of them, they're trying to get to you guys. And not to say it's funny because it's not, but like they're like, I'll have them somebody be like, we were just trying to get to morning, but like we can't sleep.
Yeah.
We feel like they're in pain and we want to see our primary vet in the morning. We have an appointment at 10, but like we just don't want them to go any longer. Like we just didn't feel it was fair, which I totally appreciate. But I think it's awesome. Like that's probably the most profound respect I have for like general practitioners, just because of that relationship that you guys do have that I don't get to see very often. Because I get to try and convince them in like 15 minutes that like, hey, I know what I'm doing, and two, this is a really large bill for something we need to do next for your pet because they're sick. And having that relationship established, I think it's just probably one of the cooler parts of the profession that I don't get to see as much anymore, just because of the nature of what we do respectively.
Right.
So that's cool.
Yeah. I actually find it to be like a huge responsibility
Mhm.
to be the person who is there for them at that moment in time. I think it's like really, I don't take it lightly at all. And it's one of those things, I will never rush somebody. I will never,
Oh, yeah.
I always try to make them really understand, what they're about to see, and talk them through kind of the process. And I mean, I think we can talk a little bit too about like that really varies from place to place too.
Oh yeah,
And I think the way you handle that really solidifies your bond with a person
totally.
forever. You know what I mean? It really, really does. And I've even had in some very odd circumstances that be how I meet people.
Oh
Like they
really?
couldn't get into like they couldn't get into their
Mm.
vet and we got them in, or some other situation, and it's like I'm actually first meeting them at this really, really sad time. And so
Yeah,
sometimes you can get them through it in a really compassionate way.
yeah.
Just
It's that
never a really
level of
happy way, but a compassionate way.
yeah, because that's one of the worst times. I guess have you ever euthanized any of your own pets?
I euthanized Phoebe.
Oh, did you really? Oh, I love fevers.
Mhm. So for those of you who don't know,
Yeah.
I had a French bulldog that Robert knew.
Mm.
Um, and I had her from the time she was 8 weeks old until the day that she died when she was 12. And man, did we go through a lot of things. We lived all over the country together. We lived in New York, California. We lived in North Carolina, Michigan, and then she made it to Indiana.
Yep.
And
Well-traveled dog.
hmm?
Well-traveled dog.
She was, yeah, there's even a picture of me holding her at the Grand Canyon when I was
Oh,
moving
that's
out
so
to
cool.
California. So, and she had had a lot of health issues. I mean, she's a big reason why I became a veterinarian. I think I said that in the first podcast.
Mhm.
We were talking about, just trying to understand medicine, and like really that bond that I had with Phoebe is kind of like, I can do this. And I
Yeah.
thought for sure. So when we were finishing up vet school, so that last year that we were
Mm.
there, I had probably done every test possible except an MRI to try to figure out like I knew there was something wrong with her, but I couldn't find it. And like, I mean, I talked to the internists, the radiologists, everybody. And finally I just thought, I think she's got cancer, but like, I just can't find it. Like I can't pinpoint it.
Yeah.
So she actually lived for 6 more months on steroids
Oh, nice.
until it spread to her lungs. And I just watched her one night. I saw her kind of breathing hard, and I thought, was wrong. So I brought her in the next day, did, some x-rays of her chest, and it was
Really?
all over her chest. And so
Oh,
it was that moment where I was like, well, I can't. I mean, if this is going to affect her breathing, to me, breathing is one of those things
yes.
I will tell people. I never ever push someone to a euthanasia. I will almost never talk them out of one either.
Yeah.
But
Oh, can't
the
say that.
one time the one time that I will usually tell people, like, I almost don't let them leave is if their dog is, um, or cat is struggling to
Yeah.
breathe, because I think that's a horrible way to die.
Oh,
Um,
100%. I think that's one thing I think people don't well, I think they imagine it's gonna be very peaceful at home. They're just gonna take their last breath and pass away in their arms. It's gonna be very like, uh, and I don't expect them to either, I guess, because like we see it all the time in veterinary medicine, but at the same time, understand like it's not pleasant. Whatever you
no,
do, like taking them
no,
home to pass away from, well, one, respiratory issues or just other issues in general, bleeding internally. Like I've had a lot of
uh-uh.
those conversations where like, oh, can we just take them home, have them pass it home? I'm like, it is not pleasant.
If you
Like
don't want to
agonal
watch this,
breathing,
yeah,
it's
it's
not fun.
awful. No.
It's
And I mean, when I was in vet school, my other Frenchie died of respiratory like failure in my
oh,
sister's kitchen.
Jesus.
So that was horrible. And I tell people, I'm like, you don't want to watch that. I was
No,
in vet school and I didn't want to watch that. So
no.
especially not being able to intervene. I wasn't in a place where I could intubate him. I couldn't do anything because I was watching
Mhm.
him die. It was awful.
Oh, I'm sorry. I
So
didn't know about that for
yeah,
Regis.
it was Regis. Yeah, he
Mm,
had a heart-based tumor, and
that's a bummer. That's
I know it was so I never want that for anybody. So I always try to tell people, I'm like, you don't want this. This is not how you want your last minutes with your pet to be, ever.
no, not at all. And
Yeah.
because I've said the same thing to people before. I'm like, it's not like I'm gonna force you not to leave, but
Yeah.
And they're like,
I'm
well,
like,
you can't tell me what to do with my dog. I'm like, I'm not trying to do that. I'm saying like, I'm trying to speak on their behalf, and this is not gonna be fun for either of you. I
yeah.
promise. Like, just trust me on this one.
And
It's
I do think people's biggest things are always like, well, I don't want them to suffer. And I'm like, okay, if that is your goal, if you do not want them to suffer, this is the time they will be suffering. If they
oh
cannot
yeah.
breathe and they're panicking because they can't tell you that they can't
Mhm.
breathe either. So this is when you
Exactly.
have to, be their advocate. But with Phoebe, I thought I wouldn't be able to actually be the one that euthanized her because I just thought there's no way I can do this. And then when it came to the time, I couldn't let somebody else do it. I had to be the one to do it. It's kind of
Yeah.
odd, is an odd thing that I wasn't expecting. But it was, me and like my husband was there, Paul, and like, it was just like this very peaceful way to say goodbye to her.
No,
And
that's nice at least. I think that's the one thing to emphasize. It is peaceful in most cases. Like, depends, like maybe an emergency, it gets a little hectic sometimes because if they're
mhm,
very stressed with breathing. For most time, it's like they just kind of slowly just relax. They take one last breath, and it is peaceful. I do appreciate that part of it. I think that's one thing I try and emphasize on is like it's not painful. They're not going
right.
to feel anything. They just kind of slowly take a nap, and they're just done
Yeah.
afterwards.
Yeah.
And it's I think it's a
We
blessing,
we
honestly.
sedate them before. I don't know if
Mhm.
you do.
Yeah. Do you guys? I'm assuming. Yeah, but I've heard. I guess I'm not sure if it's more just because a lot of people come in like, hey, I don't know if I want to do this. Like the last time I did this was a really bad experience.
Hmm.
And I think a lot of that has to do with your drug protocols.
Hmm.
I think maybe in the past, people just used Euthazol, which is like the drug that helps put them to sleep.
Hmm.
They didn't use the sedation beforehand. I think that maybe is why some people, and it's definitely like a little more the older generation, they've had a really bad experience. So
Yeah.
maybe they had a vet or pet earlier in life, and that was a bad experience then. But
Yeah.
I would say for the most part, it's a pretty smooth process in most cases.
Hmm. Yeah, I think that you can they're physiologically like things can still happen that can be
Mm.
off-putting.
Yeah.
Like so I kind of always have a thing that tell people. I'm like, we're going to sedate them. And I give
Mm.
people the choice. I'm like, once they're sedated, they don't know whether or not you're there anymore.
Totally.
So at that point, if you need the closure to stay, then stay. And
Mm.
I will do everything with you right there, no problem. But if at that point you are just they're peaceful and they're sleeping and they will not know if you're there anymore. If you'd like to go at that point and not watch their very last breath, because they can be agonal, which is just like a weird big deep breath that they can take. It happens to people too.
Yeah.
And that's even after they're gone at that point,
Yeah.
truthfully.
Once the heart stopped, you can still have that breathing, which is
Yeah.
it even honestly it still catches me to like pause for a second when I
Oh
see them
yeah.
like, oh, it
Yeah.
stopped. Like
Oh, it can
it
be.
just
I mean, and usually it happens after their heart has stopped. I mean, then
mhm.
you just see them take this big deep breath, and it is off-putting because you have to remind people like they are not alive anymore.
Yeah,
So
they're gone. But I always
I'm
listen to the heart one
sorry
more
that
time afterwards just to make sure I'm just like
yeah.
once they walk out, I'm like, okay, we're done, right? I was like, just makes me nervous, and I know it
I mean,
happens.
yeah. Yeah. And the
So
other thing too is they don't close their eyes, and I think a lot of people
yeah,
are really put off by that. They're like, "But they're still eyes are still open." I'm like, "That's an active thing. Like they have to use energy
yeah.
to do that, and there isn't any more energy left."
It's the
So
movies that cause that. Everybody's like, it's like the movie. I'm like, it's not like the movies. They don't
yeah.
close their eyes.
Although think about a lot of movies, they don't, and then people close their eyes for them. So some
This movies
movies,
are getting better. We'll say movies are getting Hollywood's getting it right for once, but there's a lot
right,
of them that are like, oh, they
right.
don't close their eyes. I'm like, yeah, they don't do that.
But if you notice, whenever they depict like euthanasia for a dog in a movie, which I can really only think of one, and it was so ridiculous that it was actually a show.
Oh yeah, which
Yeah, it
one?
was called Firefly Lane, I think is what it was called,
Can't say
and
I've
like
watched that one.
he had this big needle and he like gave him an injection. It was so ridiculous. I was like, come on, man. Like, if you're gonna do it, like do it the way that we do it. And if you don't know, ask. There's plenty of veterinarians. You call me anytime. I'll tell you how to do
Well,
anything
that's
veterinary on TV. No problem.
well,
I'm here for hire.
this is Dr. Sam coming to you
Yeah,
live.
I know. Well, that's okay.
No,
One time, this is a total sidebar, but I was watching a show and there was a broken limb on a dog that was supposed to have been like a shot or something. And it was the wrong leg. Come on, man. I got so mad. I was like, that's not the right leg.
I'm sure human doctors feel the exact same way. They're probably
I
like
am
when they
sure
watch
they
this
do.
EO shows, they're
Yeah.
like, that is not how you do CPR. That is not
Yeah.
how we do that. or they
Right.
see like a weird rhythm on an ECG and they're like,
Yeah.
nope,
Nope.
that's not
That's
right.
not right.
You don't chalk that. So it
Yeah.
happens all the time.
Yeah. Exactly.
So we feel for you
So yeah.
in your respective profession. I'm
So
sure every profession has that actually.
oh, I'm
So
sure. I'm sure.
I got a question for you
Hmm.
that came up recently for me. And as a mother, you probably answer this better than I do. How do you feel about owners will ask like, do I bring my kids into the room? Should they be there for it? And just so as a mom and a vet, how do you feel about that? Because I honestly don't know. I feel like it goes pretty well most of the time, but yeah, I'd be curious your opinion on it.
I think you have to know your kids, and I think
Mm,
you also have to be really aware of their ages. I
okay.
think that I would not, I don't think Henry, who's my 4-year-old, should
Yeah.
be in a euthanasia. I'm
Okay.
not 100% sure my 6-year-old should be. I think that at this point, Charlotte might be able to handle it, but
Okay.
I would give her the room not to, truthfully.
Okay. So
But I
you would
do
ask
think,
her then, say, hey, do you want to be
yeah.
there?
Hmm.
Okay. And
And I might even, I mean, I don't know. I mean, the thing is if Charlotte was in it, then Nora would want to be, and you know what I'm saying. So it's kind of
yeah,
like it gets a little dicey. But um, I have seen some inappropriately young children in
yeah.
euthanasias that I thought. I mean, again, I can't really judge because everyone says goodbye in their own way. Everybody deals
Mm,
with things in their own way. So really, I try to reserve like, okay, you know your family, you know your children, because I've seen some
mm.
teenagers not be able to handle it.
Oh yeah, like
You
I mean,
know?
grown adults can't have like I've seen it just
Oh yeah.
changes, and I think vets have a really hard time because I don't know if owners feel that we're judging them when they don't stay in the room with them or they do,
Hmm.
and it's tough. Like you know, and again, it's every owner's preference. I like them to stay in the room when they can, just because your pet feels more comfortable when you're in the room. They know you, and just as you mentioned earlier, maybe just for the sedation process
Hmm.
itself. I think that's
Yeah.
a great time to leave, so that way you can at least be with your pet during that phase, and they know you're
Yeah.
there. And afterwards, they don't know. You have to see what happens next. But I think it's really nice when owners are in the room if given the choice. Which I think now we're out of COVID, it's
Yeah.
pretty much a
Actually,
choice
even
again.
throughout COVID, we let people come in.
Oh, good. We did too, but I know a couple of
Yeah.
hospitals, we had owners that would come from other hospitals to come see us just because we didn't keep people out of the room. And I understand why. Like, I wouldn't want to be out of the room. And like, I actually haven't seen any of my own pets euthanasias.
Oh, really?
Um,
Yeah.
yeah, one, like, I hit by a car for one
I
with a
had one too.
pericardial
Yeah.
fusion that I couldn't get
Mm.
home for fast enough. And then, sorry, pericardial fusions where you have fluid around your heart and it's not good. Um, yeah, another one's my parents thought it was in my best interest not to know about it until afterwards. Um, we had a discussion afterwards, but they had the best intentions. It's just
Yeah.
more of,
Of course. Oh,
but I told them in the future I'd really like to know because I care about them a lot.
yeah.
So yeah, I think regardless of how old your kids are, I think having that conversation I think is a good idea. Just to kind of see if they want
Yeah.
to be present.
And I think that you should definitely let them say goodbye, whether or not you're going to let
Mhm.
them be in the room. And I know for me, like I love when kids are in the room, like
Mhm.
just in general. Like I love
Yeah.
interacting with kids, like letting them listen to the heart and like,
Oh yeah,
like on it for like a happy visit. And so
yeah.
like I will never get upset if people have their family in there. I mean, I'll come in sometimes it'll be like the whole family in the room.
Literally the whole family.
The
Sometimes it's
whole
like 20
family,
people.
yeah.
You're like, this room only holds like 10.
Yeah, right. But the fact of the matter is that as long as everybody understands that there's a process, and I mean, there's times, where it's really hard depending on your process, like, to get a vein if you don't put a catheter in, if you do, I don't know, I mean,
Mhm.
everyone does something a little bit different. So,
Totally.
so I think that the protocol that we use works well because the sedations are very strong.
Yeah.
They're covering for any pain. And truthfully, they are not awake. Like it's what we would use to sedate them for us, like a short procedure. So
Mhm.
they are not aware of anything once that happens. And that's like we put an injection in the muscle to get them to go to sleep. And then
Okay.
I'll do the injection in the vein,
Okay.
with the final injection. So
Nice.
um I do, and I've done like a similar protocol, but just with different medications, and
Mm.
they both worked well. So, I mean, I think that there's a lot of different ways to do things.
Oh yeah.
And I think the more peaceful and the more calm and the more time that you can give them to just, say goodbye in a really peaceful way is the best thing that you can do. And
Mhm.
then whether or not people stay past that, I really don't have an opinion. I find the hardest part of euthanasia, there's two things.
Mm.
One is the guilt that people feel about having to make that
Yeah.
decision. And I tell people every time, you I you have to let go of that guilt. It is your job, it's your responsibility at this point. It stinks,
Mm.
but to do what's in their best interest. And then the other thing that people want to know is if I think they should euthanize them. And I always tell people,
Yeah,
I
that
can't make
question.
that decision. It's not for me to make that decision, but I
Mm.
do try to coach people through, like, well, when were they last, like like the things that make them them, like,
Yes.
do they enjoy those things anymore? And
Mm.
do they, like, you try to tell people like what quality of life is, right? And like I tell
Yeah,
people, like,
exactly.
you don't expect that your 14-year-old dog has the same things that they enjoyed when they were a puppy. Obviously,
Mm.
they have a new kind of quality of life, but are the things that make them still there? Do they still
Yep.
have things that they enjoy, or are they having more bad days than good? If you're having more bad days than good, they don't have to be down and out and completely on death's door for me to
Mhm.
say that it's time. That's for me personally.
I agree. I've kind of described things similar to owners because that issue comes up all the time. I'm like, it's hard for me to give you a straight answer because it's complicated, right? There's and especially and again, maybe I'm not sure how finances are always important, but like
Hmm.
I don't want to see you lose your mortgage because of it either. Like I've had owners be like, "Oh, we got to do the surgery because but I can't afford to pay my mortgage this month, but it's the dog's more important." I get the dog's more important, but you got a family of four, and you got to make sure you have a place to live. So answering the question, although we appreciate it, we know it comes from a good place. Answering that question, I think of like, what would you do? It's a tough question because, like, no offense, I get my vet care for free because I'm the one doing it, so it
Right.
takes a huge factor out of it.
Yeah.
And
And
then at
that's
the
what
end
I
of the
always
day,
say. I'm like, "Hey, we're not having the same conversation. I'm here."
mm,
So, you know what I mean? Yeah. I mean, it's hard.
exactly, it is tough. And I had to tell him kind of similarly, like the day Loki can't run, well, probably the day up I'm just like because he loves to be active and jump around, and even at 12, like he still bounces around like an idiot,
Hmm.
and that's what makes him happy. Like food isn't his driving force. He likes food. Don't get me
Well, he's a
wrong.
husky. He may not
Uh,
even eat for a day.
it drives me nuts. But like my techs feed him food all the time. And he loves their food. So shout out to them for making him a couple pounds heavier now. But at the end of the day, it's really just about their quality of life, and if they're still doing those things, like you said, that are important to them. And yeah, it's not an easy decision. I feel bad. I know it's gonna be tough for me when I have to do it one day.
Yeah. No,
And I know it's gonna
it's
be
not
tough.
easy. Yeah, it's
So
awful. And I think the other thing too is that, like, it's hard because some people, what they consider to be like a poor quality of life may not be even what I consider to be a poor quality of life.
mhm.
So it doesn't really matter what I think. You know
Yep.
what I mean? Like, you live with them. So like some
Mhm.
people will put up with way more than I would.
Oh yeah.
I mean, there's
Some people are so impressive.
some
Like,
people, I mean, just for me, there's a point to where I would say, I don't think this dog has a good quality of life. But if they think they do, well, who am
mhm.
I to? I mean, they live with them every day, so who am I to say that that's not true? There are certain things that are like beyond. Like, I'm not gonna, if your dog can't breathe, then I'm not gonna agree with you that they have a good quality
Yes.
of life. Like we said before, if your
Yes.
dog is urinating all over themselves and has like sores everywhere because it can't move, okay, then we're probably not gonna agree that your dog has a quality of life. Like some like really
Yeah.
like very obvious matrix of like quality of life. But I mean, some of the other stuff, I mean, dogs come into our clinic that have been not walking for however long at home or not eating or
Mhm.
whatever. They get this big adrenaline rush and then all of a sudden they stand up, but it doesn't mean that they're going to go home and
Yeah.
not crash. So I'm just going to
Exactly.
believe you when you tell me that this is what's been going on, because I
Mhm.
believe that you love your dog, and I believe that and I know you, and we
Yeah.
have this relationship, and I can tell you that if Fluffy is no longer doing the things that make Fluffy Fluffy and we've had
Mhm.
more bad days than good, you don't have to convince me that it's time. I trust you.
Yeah. And a lot of owners will ask, like, well, I guess I try and tell owners more so. Like, I don't have anyone come back and be like, "Hey, I regret doing it too soon."
Ever.
There's
Never.
so many people say, "Hey, I waited too long for this one," or "My last dog, I waited too long for. I don't want to do that with this dog or
Yep.
cat, for that matter." So,
Yep.
I think that's a big thing. It's nice to be able to say goodbye on your own terms, and you don't get that when you wait too long
Yeah.
sometimes.
Yeah. And also too, I like going back to the other thing you said, like they don't just go home and fall asleep and die. Like
No,
that is so rare.
so
And
rare.
so rare. And
Yeah.
it's great if that
Mm.
happens and you didn't have to make that decision and they didn't suffer. I mean, gosh, I wish that for any of us, right? That we just have
Oh
this
yeah.
beautiful life and fall asleep one night and no pain. But unfortunately, like the responsibility that we have as pet owners is to
Mm.
not let them suffer. And the other thing, I don't know if you get this a lot too, but people always ask, like, this has to be the hardest part of your job. And the fact of the matter is, the hardest part of my job is watching people let their animals suffer. That's the hardest part of my job.
Yeah, I have to agree with you. Like yeah, like a decision that we know as doctors and just as pet owners, like is the right decision. And we know why you don't want to let go.
Hmm.
I get it 100%. I've even gone back and forth a couple times, like things that I thought I'd be like, yeah, this is the issue that I'll be like, no, we're done. And I've been working out in San Diego for too long now where like if Loki had a bleeding abdomen 4 years ago, I've been like, yeah, it's time, dude. Like, but now I'm like, yeah, I'm gonna do it just because I see people do it more often now. I just so it's hard to let go. And but seeing the ones like the respiratory cases where they're having a hard time breathing, take them home against medical advice or just the bed sores. Like the bed sores are a big one. Seen that quite a bit. That's tougher. That's way
Hmm.
tougher. I
Yeah.
consider it a blessing and kind of a I get to take away their pain in most cases, which
That's for me too. If I can stop
yeah.
suffering, and I think that that's where we come from with it. It's not that I enjoy ever like ending
Mm.
a life. That's
Oh
not,
no.
that is hard. There's no
Mm.
question. And I mean, I cry with my owners all the time. You know what I mean? This isn't something that I like have no feeling towards because I've done it so many
Mm.
times. It's not that at all. But it's just if I can end suffering, if I'm looking at an animal that is just like, I'm done,
Yeah.
then no, it's not the hardest thing. The hardest thing are
No.
the ones that are like, I'm done, and then they leave and go home. Those I think are harder, truthfully.
Yeah. That's and there's also even like cultural differences that, I've actually had a couple of my friends that, and I understand it. I was asking a couple of my friends that are, of different cultures, and they're like a lot of times they don't believe in euthanizing in general, and
Hmm.
it's a cultural thing. That's totally fine. It's harder I think to understand because we understand why, but it just takes some adjustment and trying to understand each other. But yeah, sometimes those are tough cases too because you want what's best for them, and so do they. They really do. They
Hmm.
care about their pets so immensely.
Yeah. Oh
It's
yeah.
honestly a huge shout out to some of the owners out there because I think you mentioned it earlier. Some things people do for their pets, like they make them. I don't even eat as well as some of my
Yeah.
pets do. Like
I
some of my
know.
patients' pets do. Like
Yeah.
they're like feeding them gourmet meals. Like make every single meal for them. They give them 40 medications a day.
Hmm.
They're like these chronic cases that I'm just like, dude, good on you. Like I don't
Yeah.
know if even I could do that as a veterinarian. And I think we all understand when we say, hey, take these medications at home. We know it's tough. I'm so sorry. Like I feel
Yeah.
like
Oh
trying to
yeah.
pill a cat sounds miserable. And I know we give medications all the time for them to do that. And they're like, I can't do it. I'm like, I'm sorry. You kind of
I
have to.
know. And
But
I give props to people like all the
mm,
time for some of the regimens that they do. I mean, even
hmm
like not even end of life ones, but just like I mean like you get like a bulldog and that's an hour every night to do
yep,
it right.
yep.
That's another story for another podcast, but how to take care of bulldogs. I
We'll
will
have you
teach
lead
you.
that podcast.
I will teach you how to take care of a bulldog. Um, but yeah, so I mean, I think that it is a really, really important topic. I think it's a really hard topic. I
Yeah.
think my biggest takeaway for people, if you're struggling with whether or not to euthanize your animal, I definitely think the big questions to ask are what makes your dog or cat like, what makes them them? What makes them happy?
Mm,
What are the things that they enjoy? And are they having more bad days than good? And if you're really not sure, start writing it down. Make a bucket list. Make a list
yeah.
of like, Fluffy's happy when she is with us, but she has not been with us. Like she's been hiding in her room or under the bed or whatever for a week or, you know what I mean? Whatever it
Yeah.
is. And also talk to whoever else is in the house if you have, people with you and
Mhm.
kind of really have a discussion about like, okay, well, what do you think that their quality of life is? And then talk to your vet.
Yeah. Yeah. I always tell people, especially with issues that like are gonna be bigger issues later, like like pericardial effusion, we fix it. It's that fluid around the heart. We'll tap it once, get the fluid out. Maybe it stops that night. But I usually tell the owners afterwards, have a conversation at home ahead of time. Like find out what your financial limitations are, find out what your emotional limitations are. So that way next time you come in, the decision's easier. Because when you have to make the decision under stress, it sucks.
Yeah.
Because there's a lot more that goes into it. But maybe you're like, hey, we're only gonna do this 3 more times. We're only gonna do this X amount of dollars or until they're this age. Like just that way it does make the decision easier because I've had a couple clients come back afterwards, like, hey, we talked about it. This is it. We've done this
We're not
before.
going to
And
do this again. Yeah.
yeah, so like I think that actually helps you be at peace with it a little bit more.
Yeah. But sometimes I
So
think if you can buy some time and just have a really peaceful, like, okay, we know that this is the end is coming, but we're gonna,
yeah,
you know, we're not gonna make heroic efforts, but we're gonna at least try to do something to keep them comfortable in the meantime. And sometimes it is that bleeding abdomen that's like, there's a mass, it's
yeah,
bleeding, it stopped bleeding. We know it's going to bleed again.
yep.
We're not gonna do surgery, but it's not bleeding at the moment. So we're gonna, you know,
Go home, get a cheeseburger, and enjoy your next day or
yeah,
so. Yeah.
exactly.
What's the toughest euthanasia you've had?
Oh, I mean, besides my own, like having to
Yeah, we'll
euthanize
say. I
babies,
guess that's easily the toughest. Yeah,
that
I guess
one.
maybe the one that's not
Um,
your own necessarily.
Actually, I'll be honest with you, that actually wasn't even the hardest one, probably because she had a chest full of cancer. I mean,
Yeah,
and she couldn't breathe.
it's almost easier when it's straightforward like that. It's like
Yeah, I think it's when you don't know why things aren't
mm,
getting better and you don't
yeah,
have the answer. Um, I don't know that I can think. I mean, I can think of one where it was just a really sad situation. I think that a lot of times when you've known people for a really long time,
mm,
and especially if it's like a elderly person, those that
yeah,
usually is very hard for me, especially when it's been the last connection to their
significant other.
yeah,
Yeah,
and that one, those are always really, really difficult for me. And there are just, I mean, there are also those patients that I've known for so many years and I fought for their,
yeah,
you know, they had a chronic disease and it was like doing great and then it crashes and
that's a
you know
bummer.
what I mean? And you got to sit there and you're crying with them because you wanted to save them too, but you just like at some point I'm only as good as the medicine we have, the information I have.
Yeah,
Biology doesn't always follow the rules and I'm not God and I can't stop it all the time, you know.
yeah. No, it's a yeah. I don't get the personal relationships as much as you do, and I sometimes I'm grateful for that because I feel like it'd
Mhm.
be doing 6 or 7 a night sometimes and be like, oof, that'd be tough if I knew every single one that well.
Yeah. I mean, you
Yeah,
don't you don't know all of them that well. In a practice
no,
as big as mine, you don't.
yeah,
You know what I
that's
mean?
true.
But
I guess that's true.
but either way, I mean, it doesn't take much of a conversation with somebody
Mhm.
to see and like start to really empathize and like be there with them in the moment and just like I
Oh
I
yeah,
am one of those people too. I'll just like take on people's emotions, which probably isn't super healthy for me, but it
thank
but
God
I
you're a
do and
vet.
you know what I mean? And I don't even have to know you that well and I'll be,
Yeah,
with you in the moment and stuff like that cuz it's hard. It's really
mm,
hard. What
yeah.
about you? Do
No,
you have any one that specifically stands out to you?
I had one, I guess two actually, but one was on Christmas Day. It was actually a priest, um,
Oh,
and he had to go do mass the rest of the day. And I was going
oh
through like
my
a rough time
gosh.
myself,
Mhm.
but just a really nice guy. But like he's like, yeah, he's like, I'm fortunate to go do mass after this, and like knowing that he like could go do that afterwards
Yeah.
was tough. I felt bad because I was like, not only you have to like lose your friend, but now you have to go share a holiday that's supposed to be happy with a bunch of other people and keep that out of your head for the rest of the day. I'm like, it's not like you can take a day off. Like you can't be like, hey, I'm calling in sick today because you have, you know,
No.
hundreds of people waiting to do mass with you. And so that was one of the tougher ones. And then I had a, a blind woman.
Oh
Um,
my gosh.
that was tough
With
just because
her
it was a
guide
different
dog.
type of talk that I had to give, and she kept her hand on the dog's chest on the time, and it was just when the dog stopped breathing, she knew. It was just a different experience.
Mm. Yeah, I
But
bet.
so yeah, definitely some challenging ones, but
Yeah.
they all mean something to us. Like honestly, like it's
Yeah, I mean,
yeah.
that's the thing is like one particularly hard one. I mean, I've had so many people and like families that I like just love so much that
Oh
I'm
yeah.
sad that I had to be there with them. And but then also too, I'm thankful that I was there because that's what they wanted. They wanted the person who
Yeah.
knew them. And I have had that same thing where like we could have gone to the emergency clinic, but we wanted you to do it, and
Yeah.
I'm like, so blessing and a curse, right? I
It's a
guess
blessing and curse.
at
Yeah,
the
it's
same
a
time.
actually if there's
Yeah.
even one where there's a well, first of all, technology, use it. It's a great way to stay in touch with family. Let them say goodbye to their pets. That's not the one thing I've seen the most was like FaceTime.
Oh, I have, yeah. FaceTime
It's
for sure.
great. Like if you're
Yeah.
afraid your family can't say goodbye, like use FaceTime. I think it's such
Oh
a
yeah.
great thing to use overall.
Oh yeah.
So that's one thing. But yeah, because I had the reason I ever thought about it is because I had one woman, unfortunately, who was out of town, but she had just lost her husband like a week
Mm.
before. He died saving their other or trying to save their other dog in a river. They both died at the same time. And then their other dog died that night from heart failure. And this one, I was like, oh, it was horrible. It was probably one of the worst ones I've been through. But
Yeah.
having FaceTime was one of the nice things that she was able to like say goodbye to her dog. Her friend was there, like taking care of the dog. I feel bad for her too, because she was
Oh
in the
yeah,
middle of
you
all
feel
of it. But yeah.
responsible and then
Oh
yeah. It's
yeah.
so
But
hard. Oh
yeah,
my
it was
gosh.
but yeah, technology is great. It's a great way for like allowing family members to say goodbye who aren't in town.
Yeah.
Uh I've used it before. Yeah, I think
Mm-hmm.
it's great. So definitely use it when you can.
Yeah, for sure.
So.
Well, oh my, don't really know if there's much more to say about euthanasia.
Nope. I'm gonna have a good cry
But
now and go grab a
yeah.
beer. I'll see you all later.
Right. Exactly. And I think probably this podcast will be coming out after Thanksgiving, but this is actually being
Yes.
recorded before Thanksgiving. And so
Yes.
uh are you doing anything for Thanksgiving?
I get to work with all you lovely people out there, so don't feed your dogs turkey because I will see them the next day for pancreatitis. So
Oh yeah,
please
that's
don't
right.
do it.
So this is a shout out to all of the emergency workers who are going to be working while we're all enjoying our turkey and our time with our family. So thank you,
Thank you, Sam.
Robert, for
I appreciate that.
yeah.
Yeah,
And
enjoy some turkey
give all
for me.
your technicians a big thank you too.
Oh yeah, they're lovely people.
Do I
Honestly,
need to
they
like send food or something? Like what gets you guys through a night?
um our hospital's fortunately very kind. They'll get us food that night.
Oh, good.
Sometimes it's a little cold towards the end of the night. But
Yeah.
it's the thought that
When you
counts. So
actually
we
have
do.
time to eat it, because we all know you
Okay.
don't actually ever eat.
Oh, not at all. Like it's like I was like, come on, I'm sure this was good like 4 hours ago.
Mhm.
So I'll be going to Boston Market the next day on Saturday. And just gonna get a whole
Aw,
chicken for myself and just doing work. So if you want to
mashed
join me,
potatoes.
yep, you'll know where I'll be Saturday morning. I'm gonna be pigging out. It'll be great.
Oh man. All right. Well, happy Thanksgiving to you
Happy
and to
Thanksgiving to
everybody
you too,
else,
Sam.
even though, like I said, it probably will be afterwards that this comes out, but that's
Yeah.
okay.
Yep.
Um, anyway, well, that has been another Pause It podcast. Thank you so much for coming by. And next time we're actually gonna be talking about food, which is a
Yes.
really big thing that people always have tons of questions. I mean, I'm guessing you must get tons of questions too.
Oh yeah. Well, there's just so many. I mean, there's so many choices out there. Honestly, between boutique diets, grain free, not grain free, raw. Like it just. I don't know how owners make decisions in stores in the first place. So we're gonna talk
There's
about that.
so much bad information out there. So we're going to try
Yes.
to cut through all of it and just be as, open as we can be as we are here because that's what we do. So
Yeah.
we are so excited to talk about that next week. And hey Robert, if people have questions, where should
Yeah.
they send them?
They can send them to was it? Oh yeah, podcast at mybalto.com. So please send your questions. We look forward to getting them. And yeah, so
Yeah.
excited for the week.
All right. Thanks, Robert.
Thanks, Sam. Good seeing you.
You too. Bye.
Bye.